David Levine. I'm co-chairman of Science Writers in New York. I'm here with in the background, my Joseph Bonner, who's my co-chair. He's producing this. Our guest tonight is Robert Klitzman. He's a professor of psychiatry at Columbia University, College of Physicians and Surgeons, and director of the Master of Science and Bioethics Program at Columbia University. He's the author of Designing Babies, How Technology is Changing the Ways We Create Children. And I interviewed you about your book in person, when actually we did events in person. So
remember that pre-COVID, there was life before COVID.
Yes, thank you. It was a beautiful home overlooking Central Park. So that was kind of nice. So anyway, so how are you? If you have questions, please put them in the Q&A box. Don't put them in the chat box. That's for me and Joe and Robert. And so I'm going to start. So welcome. So according to a recent Kaiser Family Foundation poll, more than half of all Americans required that they worry or stress-related outbreak has led to at least one negative mental health effect. Those include trouble with eating or sleeping, drinking alcohol, more frequent headaches, stomach aches, short tempers, and other health problems. I'm sure there's going to be some divorces. I know 2 people actually got married. My nephew just had a baby half an hour ago. So life goes on. So yeah, I just found out. And so what do you think? I mean, I guess, I see there are shortages of benzodiazepines that the FDA sends me and stuff. So what do you think? So I think many people are relieved that Donald Trump is not elected. And I don't know if that affects the mental health, but at the same time, the COVID cases are going way up.
Yes. So there's a lot of factors happening, of course, as we're all experiencing. And this is obviously an unprecedented time in modern American history to have threat of massive death and harm occurring to millions and millions of people, as well as to each one of us and to everyone we live with. It's one thing, for instance, if I get cancer, other people have cancer too, but my cancer is not going to spread to everyone I know. And if you have cancer and I see you, it doesn't mean that I need to be afraid of you. And we know that psychological stresses mount. The more stresses there are, the more it's not just additive, it's sort of exponential, if you will. And people are stressed to the max. And there's several reasons, as you point out. One, people are afraid of getting infected. And of course, there's also people who've been infected, and of course, people who've gotten quite sick and people who've died. Many of us know people who've gotten sick and died. So there's threat to ourselves. There's the fact that many of us have had losses of other people. We're also concerned about the well-being and health of people in our lives. So studies have shown that mothers, for instance, are more stressed than people who don't have children, particularly mothers more than fathers. But having children adds additional stress because you're not only worried about your own health, but that of your children. In addition to that, of course, COVID has led to lots of other stresses: economic, financial, educational, occupational stresses. So there are, particularly in last spring, when schools emptied out because of COVID, you suddenly had people who were home and now had to not only work for themselves and do whatever they were normally doing during the day, but now had their children home with them. And so now had to take care of their children, and that was stressful for the children. It was stressful for the parents. There is also widespread unemployment still. And so the stress, actually, recent studies show, is higher for young people, ages 18 to 35 or so, than it is for people in their 50s, say, because young people have even more uncertainty if they now are unemployed, downsized, have a less certain economic future, for instance. So these are stresses too. In addition, of course, there are healthcare providers who face a lot of stresses. So this is all going on. Now, of course, on top of this, you have the election, and these events are not separate in many ways, of course, because many of us feel that President Trump could have done much more to have worked to prevent the pandemic, and rather than denying it, claiming it was a hoax, claiming it was a Democratic hoax, et cetera. and not arranging for a significant number of testing and contact tracing possibilities. So there are multiple stresses. They're affecting everyone. And as you say, they're having lots of effects and different symptoms. And of course, because of COVID, we're also socially distanced from each other. So whereas normally if we have stresses, one of the great ways of relieving stresses is to see other people, get social support. And now, of course, that's in fact blocked. It's been harder to obviously see people in person. And so that even increases it more. And of course, there are things we can do for self-care, going out and doing exercise, for instance, and even that is hard for many people to go out and get exercise and socially distance. Gyms are closed. So all these stresses mount. That being said, I think that the announcement today that Pfizer has a vaccine which it says is 90% effective is, I think, good news that I think should lead to reduction of a lot of these stresses. We can talk more about that.
Okay. So I have a daughter at home. She has a 3-year-old and a 7-month-old. And I said to her, oh, you know, you're so lucky to have this family bonding time. And she said, I would trade places with you in a second. She said, I want my husband back at work. I want my daughter back in preschool. I want my babysitter and I want my cleaning lady back.
Yeah.
And she said, I never get a break. I'm breastfeeding and she's, you know, I guess it was my, my imagination thinking like that. But I think it's very, very hard for her, because, and I think it is, because she's in that age range that you talk about. It's very hard because, they're facing a very uncertain future. They can get laid off. My daughter's teaching at Hunter. She's a psychologist, but her husband's had some hours back, but now they're back to normal, which is good. But it's very, I think it's hard for that age group.
It is hard for that age group, and it's quite striking. Of course, the virus is more likely to affect older people, but particularly the studies show that particularly women, mothers who have kids at home have been facing among the highest levels of stress. And I think it's also, of course, because many of us, particularly in, the epidemic is hit more up to a few months ago, especially, is hit more urban areas, particularly New York City was one of the epicenters, if not the epicenter in the US. And so many of us live in apartments. They're small. They're not meant to be lived in 24/7. Apartments were built to house you for a few hours after you wake up, a few hours before you go to bed, and then you go somewhere else. And so many of us know people who are, a couple who are in a 1-bedroom apartment, and now they're both telecommuting from home, and one has to work from the bathroom and has conference calls, and the other one is talking as another conference call or wants to listen to music or TV. And so there are all these strains. And I think that COVID exacerbates whatever cracks are there beforehand, either in a relationship or in a country or in a family. COVID sort of increases the heat, just increases the stress. So whatever little slight lines of cracking were there before are now becoming gaping holes for many people. That being said, I think there are couples and relationships where people have enjoyed the time together, no longer being distracted by going out in the evening and having to go to work. People have more downtime in some ways. But I think that overall, for many, many people, the stresses have been greater than the positives.
Well, in the very beginning, there's a very famous video by Larry David, public service announcement, saying, your country's not asking much of you. So they're not asking you to go to war. They're not asking you to do anything. They're asking you to stay home and watch TV and, sit in the couch. And for a while, I think people thought that was, we were going to do that through the summer. And then it would be kind of over. But now it's getting dark at 5 o'clock. I'm in New York, and today's warm, but it's going to get colder. Thanksgiving is a couple of weeks away, and there's lots of questions about, we've been told not to get together with family. And I think that a lot of people are seeing that, even with, if there is a vaccine, It's going to be a mass distribution. I mean, Pfizer's is a 2-dose vaccine. They had a program on 60 Minutes yesterday saying that they're ready to distribute these vaccines, but like the New Jersey Health Commissioner said that she was told she was going to get 100,000 doses of the vaccine, but that's only good for 50,000 people to get 2 doses. And they said, well, how many do you need? She says, a lot, like several 100,000.
Well, several million. I don't know what the population of New Jersey is, but I assume it's several million.
Several million, yes. So, yes. And then there's going to be people who don't want to take it. So we're going to be wearing masks for a long time.
Yes.
And
sorry, go ahead.
So I guess, so how do people cope with it? And also, I'm curious about the patients that you see. I mean, how are they doing?
Right. So you raise a lot of important issues. So uncertainty is very stressful. Studies show that not knowing a bad diagnosis, for instance, there were studies with HIV testing, for instance, years ago, that when people didn't know their test, it was much more stressful than for people who did know their test and found out they were positive. Same with genetic testing, often for a serious disease. The unknowing is you don't know how to sort of settle. Whereas if you know, okay, this is the problem, now I can go about and deal with it. In some way, psychologically, it's easier. So uncertainty itself is hard. I think one thing that the Larry David comment, I think, is important because it shows the importance of reframing. That I think, and also I should say, one thing that has come up that I think is not quite commented on as much as it could be is people's adaptability. I'm struck when I have Zoom calls with friends and everyone is basically sitting home and they're able to watch TV or be with their significant other or their family, and there are things they're able to do when their work and life is, for many people, not all, for many people, life has gone on. People will wear their masks, but they've kind of gotten to the rhythm. And it reminds us that in some ways, many of us have been fortunate that we have never lived through a major war. Our country's never been really attacked. I mean, yes, there was 9/11, but many of us have not personally been attacked versus if you lived in Europe between 1914 and 1940, you were in a state of where war was a common occurrence, where many people, millions of people would die around you and you might as well. And so I think that today, I'm not diminishing the threat, but I am impressed that many people are managing to adapt, and it's stressful, but they're managing to go on. And I think reframing is important to realize, as Larry David was saying, that we should appreciate the good things that we do have, that many of us, even though many of us have known people who've gotten the virus and some have died, and many people have had the virus themselves and have had symptoms, that many of us remain healthy, that we're able to enjoy things, we're able through Zoom to talk to people, we're able to work from home. Think about if this had happened 30 years ago before there was the internet. We wouldn't be having this conversation right now and being able to see each other and people being able to ask questions in this way. So I think there are a lot of things, again, not to be rosy about it, but I think that there are, it's important, I think, for people to appreciate their resilience and realize how I think people have, especially New Yorkers who've faced, the brunt of the epidemic for several months, have managed to be tough and to move on in many ways and to survive that. And I think those are wonderful things. And I think appreciating what one does have is one important element of self-care. It's not to deny the problems, but to appreciate the positives that are there.
Well, I've been struck by, Paul McCartney has a new album coming out, and several other artists have done albums. I forget who it was, but he released a new album plus 14. So some people are just, going on with their work. I mean, Shakespeare wrote King Lear during the plague. He didn't have Zoom. So, all right, so I'm going to take a question.
Yes.
Because I'm in New Zealand. Okay, thank you for tuning in.
Thank you for joining us. I mean, it must be, well, I guess it's 7:45 in the morning or so, give or take there.
14 hours, I think. The stresses you talk about due to so much community transmission is foreign to us here. However, the stress of going to lockdown and the unknowns was worth it compared to the life we can lead now with so little community transmission. Our relationship with COVID-19 and complying public health measures is connected to our own understanding of the risks and consequences of getting COVID-19. Okay, now we have the question. How does our experience convince those in America and other hotspots to follow public health advice, which ultimately reduces so much stress?
Well, thank you, listener in New Zealand, from your ear to the White House. I think what's happened is that, and there have been other countries as well, South Korea, that have done very well. Unfortunately, I think that, to be blunt, my own opinion is that President Trump thought that he wanted to get reelected and thought that a strong economy was a major element of his campaign, and that the virus threatened that. And so he denied the virus. And as part of that, made fun of people who were wearing masks. The first presidential debate, he made fun of Biden for wearing a mask, a big mask or something, he said. Of course, President Trump then got infected himself and was hospitalized. But I think that Trump's denial of the virus and his criticism of public health measures to protect people from the virus has trickled down, so to speak. Trickle's too weak a word. It's cascaded down. It's flooded down. And so a lot of Trump supporters, as we see from his rallies over the past few months, don't want to wear masks, refuse to wear masks, revel in their not wearing masks. I think one element that has fueled that has been misunderstanding of masks. So what Trump supporters who object to masks say is, it's my right not to wear a mask, I'll just take the risk of being infected. But of course, one reason to wear masks is not only to protect yourself, but arguably even more important is to protect others. And we know that about half of people, 40 to 60% at least, of people who are infected are asymptomatic and don't know they're infected, but are able to infect others. And so a big reason to wear masks is because if everyone wore masks, the epidemic would go away, basically, because people wash their hands, et cetera, because people who had the virus would not be spreading it. And so it's refusal to wear masks that has been spreading the virus. There's a need to wear masks. I think the messaging about that has not been as effective as it could be. And of course, this is also from on high. The CDC has been castrated, maybe too strong a word, but it's been defanged, it's been weakened, and has, I think, not gotten the message out as well as it could, that the reason to wear a mask is not just to protect yourself, but protect others. Similarly, for instance, you can, there are signs in many states when you go in a store, you must wear a mask, but no one enforces it. I don't know the details of all the state laws through the US, but if the state law said, and there will be $1,000 fine if you don't wear a mask in a store, more people would wear it. I think there's not been the political will. And I think a lot of that comes from Trump feeling that to acknowledge the epidemic and respond appropriately from public health points of view would damage his own chances of reelection.
Well, people, tell me they can't, you can't force people to do things they don't want to do, but people do obey speeding laws. They wear seatbelts because you get a pretty good fine. Now in France, if you want to go out, France is on lockdown again. If you want to go out in France, you have to print a form out which says, I'm going to the drugstore, you have an hour. I'm going to the grocery store, you have an hour, and then you have your exercise. And if you're found like more than 10 kilometers from your house, you get a 1,500 euro fine.
Right. That's
pretty good. That's that's like $1,800. So it's that enforces things, and people are complying with that. Now, people told me that when we first had the smoking laws in New York City, that fistfights would break out because there were only 4 people assigned to enforce their law, but it became a very self-enforcing law, and people don't smoke. You don't see people smoking in restaurants.
Yes, and the similar thread through all the examples you've given, which are seatbelts, smoking in public, and speed limits, are similar, and wearing masks, because in the as you said, people say you can't force people to do what they don't want to do. You can in the name of public health. So in the name of public health, we say that you must wear a seatbelt, because if you don't, we know that people are going to end up in hospitals and for sometimes years with major problems that cost the public. So when we smoke, it's because once the danger of secondhand smoke was clearly revealed, you were then, if you smoke, placing other people at danger. And so it was said by law, you cannot smoke in a public place. And I think that, I think it was Louis Brandeis who said, one Supreme Court Justice, or Cardozo, who said, your limit to freedom of speech ends at the point at which you yell fire in a crowded movie theater. And so the state, I think, does have the right to enforce things by having penalties. That being said, of course, I think we as a country are uncomfortable with that. And so there are countries, for instance, in Hong Kong right now, where if you're quarantined or on lockdown, you get an electronic bracelet. And if you leave your house, the police come knock on your door. We've not gotten to that point because I think we are trying to balance public health with civil liberties and have believe in civil liberties relatively more than other countries. South Korea, for instance, has apps on people's phones where when you walk into the drugstore or the grocery store, it says on your app who in the store has had COVID. So you know that someone in aisle 3 has had COVID. In this country, people don't want that, understandably, because it would sort of out the person as having COVID. But I think there are different levels of action that we could take, and I think that may be considered under the Biden administration.
That app is available in New York. So my cousin in Canada told me she had surgery and she had a quarantine, and because she got COVID, in the hospital when she had surgery in March, and they call you up and they say, we just want to check if you're home. She said, I'm home. He said, oh, will you please come to the door and show us? So, I mean, it's accepted there. All right, so we do have a lot of questions. So let's go to them. Do you have any insights into the impact of COVID-19 on substance use disorders, and what kind of resources might be available to individuals that are struggling with alcohol, opioid, stimulant use while isolating from other people and navigating all the stresses associated with the pandemic?
Yes, great question. Yes, so given that there's all this stress, many people, when stressed, resort to substances, alcohol, pot, other substances, as you mentioned. So under stress, there will be an inclination for people, particularly who've had addiction issues before, to again start using these substances. So there's a major problem. Unfortunately, because of social distancing, there's good and bad news. The good news is that there is now telepsychiatry that's now being reimbursed for the first time by insurance companies, where you can talk to a therapist through Zoom and the therapist can get reimbursed for that. So many therapists are doing that. On the other hand, it's not as good in many ways as seeing someone face to face. It may not be as good. I have concerns about that. I think face-to-face is generally better than, I think, because when you are on Zoom, you may miss interpersonal cues that you can see. We don't see the whole body, we're just seeing the face. So if there's, if someone's suddenly getting tense when talking to you, you're not seeing that in the room. And also, unfortunately, in the initial stages of the COVID epidemic in New York and elsewhere, when hospitals had to focus just on treating COVID patients, unless was known about the virus, many hospitals emptied out their psychiatry wards and discouraged people from coming to the hospital for mental health problems because there was COVID in the hospital. I should add that another stress of COVID is that not just for mental health problems, but for other medical diagnoses that weren't COVID related, things like cancer and heart disease, patients also were either being dissuaded from coming to the hospital or got the message they should stay away from the hospital because of COVID. And so we know that there have been increases in deaths due to other kinds of medical problems, heart attacks, cancer, for instance, where people who would have gotten treated in the hospital and survived instead stayed home, got sicker, and often died. Same with substance abuse. So I think there's an extra layer of difficulty for many people in getting treatment. I think that it's important to engage with support such that you may have. I'm sure there are online AA groups, therapists who are available online, et cetera. So I think that to try as hard as one can to get support would be important.
Okay, so here's the question. What advice would you give to someone who lives alone, works from home, and has been coping so far very well with isolation, but is now growing fearful with the loss of daylight and the impending cold weather? Are there any mind tricks to avoid feelings of depression and panic?
Yes, so great question. And I should say, just anecdotally, my sense is people I know who live alone are having extra layers of problems because they're not ordinarily seeing someone day to day. So I would encourage you still to go outside when it's light out, go for a walk around the block, get some sunshine. We know that that's important. To do self-care, exercise is important. One can do exercise at home. There are various, Pilates classes online and yoga classes online where you can do it, quote, with other people, though virtually. So exercise is important. Sleeping, getting adequate sleep is important. And eating properly, avoiding substances, I think, substance use. It's tempting just to have, some extra wine or whiskey or whatever, but that we know can lead to, in fact, more depression and more anxiety. And I think also reaching out. I'm surprised a number of people who I would not have thought of calling, and they've called and Zoomed, and I've been thrilled to be able to sort of reconnect with people. So I think that others are in the same state, and I think that we should all try to reach out to people, even if they may be people we may not otherwise call up. We're used to maybe occasionally seeing them, or maybe see them once a year, but maybe reach out to them more. So I think that reaching out and extending to one's supports, or even people who you may not have thought of otherwise contacting or calling up or Zooming, I think could help.
Well, I live alone, and one thing that's helped me is doing these weekly interviews.
Well, there you go.
Keeps me focused.
Right.
So let's see. You mentioned that the stress is particularly high among young people, and this is connected some to uncertainty. Do you think there is any risk of long-term psychological effects, even after this is all over, in the younger generations?
So that's a good question. And I think that there will be ongoing studies. So I think here the population breaks in that there are different groups. So one is people who did not get COVID. I think that I would hope that there won't be the kind of sort of PTSD that would lead to ongoing symptoms, that I think that people are resilient and will be able to, if they've been healthy and haven't become addicted to become alcoholics at home, et cetera, for the first time, that people will be resilient. That being said, I'm more concerned in response to that question about people who got COVID. So we know that people get COVID, about 20% need hospitalization, and about 2% die. So people who are hospitalized with COVID, especially if they're on ventilators, there's a lot of symptoms that come with that. We know that COVID, in fact, infects the brain. We know that 80% of people who are infected with COVID have some psychological symptom, some mental health symptom or neurological symptom. 20% of people who've had COVID, regardless of age, say that 2 to 3 weeks later, they still have confusion. So there are, I think, people who have developed COVID, I think may have some long-lasting residual symptoms. And I think that's of concern. And I think it's going to speak to needs for us to prepare adequately by having adequate mental health treatment available, mental health services available, insurance. And of course, there'll be the Affordable Care Act is going to be up before the Supreme Court potentially. And I think that it's important that adequate health insurance for people continue, especially given COVID. And I should say that will be added not only neurological and psychological effects, but there may be added respiratory symptoms, other kinds of symptoms that people have after being infected.
What's been the biggest challenge for your mental health management, and how have you coped with it? We're talking about the pandemic causing a mental health crisis after the first month or two. Now we're 9 months into this. How has that concern changed or developed?
Yeah, so that's a great question. I'm like everyone else in the sense that I'm glad to have focused on work I like doing and be able to interact with people online. It's not the same thing. I'm fortunate I'd be able to do some work that I enjoy doing. But I think I've been staying for a while in my sister-in-law's house in a rural area in Pennsylvania. And so I'm not with people I like seeing or I'm used to seeing. And also I'm outside New York. I've been outside New York recently. And so I'm not able, and of course, things that I like doing in New York are not open now. So going to the theater, going to shows, going to museums, in addition to seeing friends, going to restaurants, these are things I'm not able to do. So this has been stressful. I try to deal with that by finding other things I like doing. I've been reading books I've never read. I've made a point of listening to music I've never read. Recently listened to all the string quartets of Mozart, the 8 hours worth, watching movies I've never watched. So I think that there are things that one can do to bring some excitement into one's life to make up for the fact that in many ways our lives have been locked down to some degree.
Okay, I want to ask people who are asking questions, please put in questions that don't just put in facts or comments that other questions people are asking. I want the questions from Dr. Klitzman. So Germany is going under lockdown to some extent. France is under lockdown. England is under lockdown. Do you think the United States should be going under lockdown?
So the issue in the United States is that
I know it's state by state.
Yeah. So I think that if there are regions, I would hope that there would be adequate ways of avoiding that. If everyone wears a mask and socially distances and wash their hands, there shouldn't be needs for lockdowns. Lockdowns occur because people are not doing those things. And so I think that it behooves public health authorities, but also all of us, to encourage each other to wear masks, to abide by that. It's awkward socially. If you go to a party in a restaurant or walk down the street and someone's not wearing a mask and walks right by you, what do? Do you say, put a mask on? I think that we should try to encourage each other to wear masks. On the other hand, there have been well-reported instances of someone saying in a store to someone, gee, can you wear a mask? I have asthma, I'm immunocompromised or in some way or whatever. And there's been violence, right? People have gotten both physically abusive, but also verbally abusive when asked to wear a mask. That's unfortunate. Again, I think a lot of this is the political climate that we live in, which has been so polarized among many things, but also about masks. So that people, as I said, feel empowered by President Trump to disregard masks and in fact to bully people who ask them to wear masks. Yeah,
I asked someone to wear a mask today in the laundry room because there were many elderly people there, and this person started yelling a little bit at me, but this young person got very shaken up, started yelling at him and threatening him, and I just said, we're going to call the police, and he left. But it's right, there is a potential for violence. So someone said in Spain, you can't be outside unless you have the government permission. So some countries are very strict. Putin has said, if you break my quarantine, I'll put you in jail for 5 years.
Only 5 years.
And he'll give you his vaccine. So because there are vaccines in Russia and in China.
Yeah, one issue, just getting back to the issue of lockdown in the US, is that we know there's not one epidemic, there are many epidemics. So the epidemic in New York City, the epidemic in Queens, or certain areas in Queens is different than certain areas in Manhattan. Of course, we tend to have policies that are municipal or statewide or national, so we can't make some of these fine gradations, but I think that more can be done. I think that why not say there's a $1,000 fine if you don't wear a mask? I've not seen that, and I've certainly not seen it enforced.
How do you offer help to elderly people in nursing homes or assisted living who are frightened of getting sick and dying of this disease, which we saw does happen? Yes.
So I'm not an expert on nursing homes, and this is a controversial area, I know, where there has been concern that nursing homes initially did not have enough PPE and or did not properly use it or should have been able to use it more. And so this is actually going to be there have been a series of policy questions that have come up, where the Governor Cuomo, for instance, initially said that doctors have immunity from civil and criminal liabilities, I understand it, if they're treating COVID or related conditions, or there's some language that gives sort of a penumbra around the COVID itself that would include what goes on in nursing homes. And there's been pressure to remove that, which I think has been removed. I'm not sure the exact status of the law at this point, but there's a question: should nursing homes be held responsible for deaths that occur there? What if it's simply because there wasn't enough PPE? Nursing homes certainly are. Nursing home staff may not all have been wearing PPE when they should have. So I think that I suspect that nursing homes clearly need to be as vigilant as they can be. They should be as vigilant as they can be. Whether or not they've all been that vigilant, I don't know. But I suspect that there are things that they can do to help be as vigilant as possible. And of course, PPE is important, and I would hope that there's enough PPE at this point to help protect nursing home people who reside in nursing homes.
So what do you think of people doing meditation, deep breathing exercises? Are these helpful to people?
Yes, extremely helpful. All that's very important. I said exercise, but I mean meditation, any kind of stress reduction techniques, I think can all be helpful. These are unprecedented times. We've not had to, in my lifetime, deal with this kind of disease and lockdown. And as I said, there's several stresses. It's not only a threat to your own health, threat to the health of people you love, being locked down, not being able to have social supports, not being able to do things you otherwise want to do, et cetera, et cetera. So I think that in addition to exercise, meditation, all that's extremely important and helpful. And I think for some people, spiritual practices that they may engage in. I think there's a lot of online churches, spiritual groups, and other online groups. People I know have joined for the first time reading groups, writing groups, discussion groups of various kinds. I think all that can be helpful.
Well, someone asked, do you feel clergy can play a role in being part of the solution to all of the distress and anxiety, depression?
Yes, I do. I think that for many people, religion, spirituality, obviously people with their own views, but for many people, this is important. There are people I know who say that they prefer online church now because they could sit in their bathrobe and sip their coffee and the minister is speaking just to them 1 foot away, and they can hear better than when they were in church, et cetera. So I think I would hope that clergy are reaching out, and churches could be great sources of social support for many people. And I should say people who aren't, and of course, church attendance has dropped, but I think that, there are, book clubs and, as I said, writing groups or any other kind of group, I think that where people could find like-minded people to communicate with is great. I think also extended families have also often gotten together more on Zoom or calls. I think all that's wonderful and very important.
So I think one stress, which is just, I think, I've been to 3 museums. I've been to the Metropolitan Museum, the Museum of Modern Art, and I've been to the New York Historical Society. They take you have to make a reservation. I also went to the Botanical Gardens, which is beautiful. But they take your temperature. You have to make a reservation. And my friend walked through it. His temperature was 103. And then he freaked out, obviously. And then second person walked through it, same temperature. So they said, okay, walk through a different machine and check the temperature. Temperatures were normal. But everyone is like, it's like, sometimes I've gone outside and said, I forgot my mask. So now I pack it. But I once woke up in the middle of the night and saying, I'm not wearing a mask. I said, well, and then I realized, well, I'm asleep, I don't have to. But there's that set, there's always like, there's so many things you have to remember when you're going outside.
Yeah.
And do you go to the grocery store at 7 in.the, or do you want to be the first person in, or whatever? There are just a lot of things to, should you eat outside with somebody? That kind of thing.
Yeah, I think one way to think about this, though, is that we've been lucky that we've not had a similar epidemic in our lifetimes of this magnitude. Many of us have not. However, historically, humankind has. when you think of the Black Death, the bubonic plague in Europe, it wiped out 50% of the population of many cities, and the cause was never known. So it would come back every few years. It wiped out, 30% of other countries. There have been the 1918 flu pandemic wiped out, tens of millions of people. HIV, of course, was a major epidemic. It affected more particular communities, gay and lesbian men, gay men, et cetera, bisexual men, sex workers, et cetera. But when you think about the fact that there have been serious diseases that we no longer get in this country, cholera, polio, smallpox, that wiped out historically, a huge percent of our population, we've been spared this. In 1900, the average life expectancy in America was about 44 years old. So we've come a long way since then, right? So average life expectancy is, 79 to 82 or so, depending on your gender and race and ethnicity play a role in that. So we've almost doubled life expectancy in this country. So we have, up till now, been very fortunate, in some ways lucky, and in some ways that's not the norm in human history. The norm in human history is to have lots of infectious disease that was wiping out people. Believe me, I don't want to return to that. But I think to put this in historical context can be helpful. So there's enormous inconveniences. I'm not minimizing those by any means, but it's important to realize that we've also been fortunate that our life expectancy overall in this country has generally been going up until this point, up until the opioid crisis, and that historically these, unfortunate, fighting infectious disease has been a major part of human history that we've fortunately, luckily, been spared up till now.
So I think this is going to change health habits. I mean, I see a lot of people, it's hard to get a flu shot now because you have to make a reservation. People really want to get them. And I was on a phone call with Anthony Fauci, who was saying that we've accepted that 60,000 people a year are going to die from the flu. And he said that I think from now on, we're probably going to have a light flu season because of if people wear masks and social distancing, because in the Southern Hemisphere, they did have a very light flu season. But he says that, we're going to have to be changing our behaviors a lot. And for a lot of people, that's not easy to do.
Right.
And flying, everyone says is safe, but now there's new studies coming out saying there was a big super spreader event on an Irish airline. So, I think it's really difficult for people to navigate, life is always uncertain, but I wasn't planning on a pandemic, although, Monty Python said no one expected the Inquisition. So but in 1968, there was a pandemic, the Hong Kong flu.
Right.
And they held Woodstock, but people didn't get that sick sick.
Yes, and I should also say, of course, that in recent decades, there have been a series of new diseases, quote unquote, that have broken out, HIV, but also H1N1, the Hong Kong flu, quote unquote, MERS, avian flu, West Nile virus, Ebola, Zika. And many of these are related in that what's happened with Zika, for instance, because of climate change, there are changes in where viruses live, that mosquitoes that once lived only in hot areas, now as other areas warm up, mosquitoes are moving there with whatever diseases they're carrying, et cetera. Species are under pressure. There's some thought that one of the reasons that we have COVID is because the bats were under pressure to move somewhere else because of population spread in China, et cetera. It's one theory. So I think that these things aren't related, but there have been a series of epidemics, and there'll be others. This is, this version of COVID, which is also a version as a coronavirus of SARS. And I should say, by the way, that coronaviruses account for about 30% of all common colds. We've all probably had coronaviruses at one point, but they mutate. And of course, there's a concern that this virus too may mutate. There's some evidence that it is. So I think we may have to get ready for this. And of course, part of this is because of globalization. that it used to be that if a virus breaks out in a little town somewhere in China, it stays in a little town in China. Now, anyone can get on an airplane and within 24 hours be anywhere in the world, along with all the infectious diseases in them. And so we're part of the problem is because of global travel and globalization, we're now traveling all over, and so are our viruses and bacteria, and that's part of the problem, and that's going to be continuing once we're after COVID.
So the people who call you for therapy, are they asking you for medication?
So I don't treat patients at the moment. So,
okay.
But my colleagues report that they are seeing lots of patients who are stressed, yes. And patients, particularly as we mentioned, certain groups, the elderly also are often very stressed. People who have, of course, another area that I should add that stress is particularly high also among people who have pre-existing health conditions and pre-existing mental health conditions. So people who've had whatever the disease is or have depression or anxiety, on those people, there's even more stress than there is on everyone else.
So now minorities have been very highly hit by this. And as we know, for various reasons, because of comorbidities like diabetes and hypertension, but they also don't have the same access to therapists to talk to. And, I think this has shown that we really need a better public health system in the United States.
Yes, absolutely. Yes. So and thank you for bringing up the issue of minorities. So it is unfortunate, extremely unfortunate, that rates of COVID are about 3 times as high among African Americans and among Caucasians. Rates of death are 2-3 times higher. Rates of COVID among Latinos are, I think, double, thereabouts. A lot of that is due to poor prior access to healthcare. That we know that there are enormous disparities, unfortunately, in this country in healthcare access. And so you have communities of color that have had poor prior healthcare and therefore have more pre-existing conditions, and those make them more vulnerable to COVID. And also a lot of people of color ended up being frontline workers. Some of us could telecommute. If you were a bus driver or a truck driver, worked in a grocery store, or you were less able to telecommute. And so communities of color in the New York area and others were more likely to be exposed to the virus also, which is very unfortunate. And of course,
and there's also a class resentment. I mean, there are a lot of rich people went to the Hamptons. The city was very empty. I mean, I could walk across any street and not have to even look for traffic. I would, but you didn't really have to.
Right.
And so I think that our economic disparity is also an issue here.
Yes, of course, because you have lots of people, the unemployment's increased. And so, the gaps between the haves and the have-nots are one of these, again, an area where there's fracture to begin with, and COVID just makes the gap and the fracture lines worse. And this is unfortunate.
So here's a question. SARS back in 2002 was also a coronavirus. What are your thoughts as to why we didn't learn from the previous coronavirus in 2002?
Great question.
I mean, first of all, it didn't really hit as many people. It didn't really hit the United States. It was more in Canada, I believe, but I'll let you answer it.
Yeah, so, right. So SARS-1, also from China, was less infectious, spread less, was more contained. Also, though, there were super spreaders. And in fact, there was evidence that fruit bats, where both SARS viruses lived as a natural host, it seems, there was evidence that coronavirus, or COVID rather, already was living in fruit bats. And there were researchers who asked for funding at that time to begin to work on this other future coronavirus that we now know as COVID. And these researchers were unable to get funding. So a lot of the problem is that we focus too much on the current crisis and don't spend enough resources and attention on potential future crises. Similarly, the problem with ventilators and the lack of enough personal protective equipment at the beginning of the COVID epidemic was because we had stockpiles particularly after anthrax and H1N1, and the federal government had let the stockpiles dwindle because, of course, again, if there is questions of whether to spend resources on our current crisis versus a future crisis that may never happen, politicians who have 4-year terms, let's say, and are worried about their reelection are worried about what's going to happen now or in the next 1 to 4 years, not what may happen in 6 years or 9 or 10 years. And I think that's unfortunate. I think if one thing that we learn, I hope, from the COVID pandemic will be to spend enough resources to try to prevent future problems. And of course, prevention and healthcare across the board is difficult, even for individuals. We have enormous rates of obesity in the US. 2/3 of America is obese or overweight. That's been rising dramatically over the past 30 years or so. But again, the notion that you should lose weight or stay slim in order to avoid future health problems is something that is sort of counterintuitive to a lot of people. So it's easy to focus on the here and now, but it's important that we learn from this to also prepare for future disasters and give some attention to that as well.
So someone has a question about, what about the frontline workers? Have they seen increases in mental health issues? Have there been increase in suicide and psychosis in healthcare providers and frontline providers?
Yes, a great question. Thank you. So healthcare workers have enormous rates of stress, of depression, anxiety. They actually, I should say, before COVID, healthcare workers have higher rates of alcoholism and depression and anxiety than does the general population. Now it's gone up even more. There have been suicides. Unfortunately, at my own institution, Columbia, there was a suicide of a doctor who worked on COVID and got COVID, got better, went back to work, and then killed herself. Part of that, apparently, I understand, was because she felt that she couldn't do much to help these patients. But there's enormous stress, and they may feel like heroes, but or be said by others to be heroes, but at the same time, they are facing lots of problems. Often there has not been enough personal protective equipment for them, et cetera.
Do you feel that this pandemic will encourage basic and applied research on antimicrobials and anti-infectives?
Yes, I hope so. I think that there has been research on these. The problem is, of course, is that, again, we react and deal with whatever the problem of the day is. So when there was an anthrax scare after 9/11, huge percentages of NIH budget were moved to deal with anthrax as opposed to deal with other diseases. So I think one issue, I think, is that there should be more funding for research in general. And of course, Trump wanted to cut the NIH budget, I think, by 40% or something. And actually, it was congressional Republicans, to their credit, who pushed back on that. But there's been an attack on science. There's been a huge attack on public health messages, on public health. Anthony Fauci, who in my mind has done a heroic, remarkable job, has been repeatedly attacked by Trump and others, Republicans here and there. And I think this is unfortunate. I think that rather than respecting science and appreciating science and the fact that it is going to give us information to know how best to deal with COVID, there have been politicians, Trump particularly, and others, who have attacked science. They also attack science around climate change, for instance. And I think this is very pernicious.
Someone was saying that in the past pandemics, the politicians were, the scientists just made their remarks and comments. Politicians didn't even get involved. The politicians just said, this is what you should do, this is what you shouldn't do. And people just listened to them. And we don't have that anymore.
Well, it's gotten worse, but it's always been a problem. So if you remember, there were cases, there was the nurse who came back who had dealt with Ebola patients in Africa. She flew into Newark Airport. She did not have Ebola. She may have been exposed.
I remember that, yeah.
Yeah, and the public health officials all say she should be allowed to go home and self-quarantine to Maine. Instead, Governor Christie and I think Governor Cuomo had a press conference that said, no, we're going to keep her against her will in a tent in the parking lot at Newark Airport or whatever. And they were both up for re-election, I think. They wanted to look strong and tough and, we're tough on the disease, et cetera. So politicians have often let political agendas influence their public health decisions. You hope, however, that it won't have the kind of damage that Trump's politicizing of the pandemic has had here, where it's one thing to use your response opportunistically. It's another to let your opportunism dictate the response such that millions of people get sick and, thousands and thousands die.
One thing that Donald Trump said that I thought was not stupid was he said that he was afraid that people were there would be a rise in, domestic violence and drug and alcohol abuse. And that was one legitimate concern he did have about lockdowns. And I don't know, but
as you mentioned, I run a bioethics program, and in bioethics we assess risks and benefits, and it's rarely the case that there is just benefit on one side. Usually, there's a bioethical dilemma in which there's risks and benefits on one side, risks and benefits on the other. So you could if you have cancer, try the chemotherapy, may help you, but may have side effects, or you can go home and you may die. Yes, there's some risk of domestic violence. However, if you do not have lockdowns and COVID spreads and 1 million people get it and millions of people die, these are terrible decisions I have to make. But if the choice is between having millions of Americans die, tens of millions of Americans get sick and be unable to work, versus a 2% chance of domestic violence, I would opt that, again, if you had to choose between the two, God forbid you have to choose, I would think to avoid deaths, millions and millions and millions of deaths is better than in having a small percent increase of potential domestic violence.
So I always like to end and ask my guests, what do they do? So have you eaten outside or inside?
I've eaten inside. I've eaten at home. I've only gone to a restaurant once, okay, and wore a mask. It was on the road off a highway, and okay, I have been staying in a rural area where there's less COVID, but I've been very careful.
Would you go to, if you were in New York, would you go to the Metropolitan Museum?
It'd be tempting because I love the Met. I would consider going to the Met following the protocols that I've not gone on an airplane. I'm a little wary of doing that.
Okay.
And I would, I think if there's something, let me put it this way, if my sister were in trouble and I had to get an airplane to visit her to, although no one else can do it, I would do it. But if it's simply to going to Florida because, I want to go somewhere warm for a week, I probably wouldn't. So go to the Met, I'd have to, I'm not sure.
Well, I asked Dr. Offit about that, and he said museums are okay. He said if they're taking precautions.
They probably, yes. Probably they are, yes.
I was in the Temple of Dendra. I was the only person there. So
you and the ghosts of the Egyptians.
Rare opportunity. So what else? Do you go to grocery stores or do you order in?
I order in.
Okay. So you're not a risk taker.
I'm not a risk taker. It's interesting. I would go to museums, but I've actually not done so yet. So I guess if I'm voting with my feet, I'm still feeling that I prefer to be extra safe and miss the museum exhibit, but it's not an easy choice. But that's my personal decision. I would not tell someone don't go to a museum.
Okay, so you're in a rural area. Do you go outside and take a walk every day?
I do, yes.
Okay.
I go running every day.
You go running every day.
And I go where there's no one else around. And if I see anyone coming, I run the other way. I stay 6 feet away.
Okay. And so you don't wear a mask when you're running?
I don't, because there's no one here. Now in Central Park, when I've been there over the past few months, I have worn a mask when running.
Yeah, well, a lot of the runners don't wear masks, but when they come to you, they do. I mean, in the tennis courts, they have you have to go in wearing a mask, and you go in, they have only one entrance open, and you can take your mask off when you're playing, then you have to put it on when you're leaving and then go out the other end. So they're pretty strict in enforcing these things.
Yeah, I mean, I think it's, the evidence is that the virus can travel 6 feet.
Okay.
Now, it's not a magic number, 6 feet. It's not like 6 feet and it suddenly stops, right? It's,
no.
There's still virus, it just trickles off. So I think, I'm 62, I not a youngin completely. And so I feel I should play it safe. I see my mother-in-law, she's 92. So part because of that, I feel I should play it safe. So I'm a little bit more cautious than some people may be, but I think the minimum is we should be clearly, wearing masks, certainly if we're within 6 feet of each other. And I think personally, it doesn't hurt to be a little extra safe.
So we should call people, right?
You should call people, Zoom people, FaceTime people you haven't, your buddies from high school or college who you haven't heard from. I think love being called. People who, whatever happened to so-and-so, the person, if you happen to see them, you'd be happy to see them, but you haven't called them in years, pick up the phone, email them.
Okay. And when should you consult a mental health professional?
Whenever you feel it's necessary. I think I would have a low bar for consulting a mental health professional. I think that they can help. I think telehealth, telemedicine, telepsychiatry could be very helpful. I should say half of people in this country who have depression, for instance, do not seek treatment. Sometimes they don't have the insurance to cover it. Half who seek treatment don't get good treatment. They may get a prescription for Zoloft or Prozac from their primary care doc who really doesn't know how to dose. And so the person may have side effects and the doc will stop it, or there may be no effect and the person will stop it, whereas maybe they just need more dose or less dose. And I think there's another huge issue, but so half of people who could benefit from treatment don't get it. Half who get treatment don't get good treatment. Half who get good treatment don't stay with the treatment. So again, there's a cascade, but I think that the number of people who would benefit from treatment is double the number that are, at least double of the number that are now getting it.
Okay, so let's end there, and let's hope that when we talk next, it's in person. And I would like that. And thank you so much. This is Dr. Robert Klitzman. His book on designing babies is great. Are you writing another book right now?
I am. And I should say I've written a few other books people might find of interest about this. I wrote a book called In a House of Dreams and Glass about becoming a psychiatrist and working in psychiatry in New York City. People might find that of interest. It's on Amazon. And a book called When Doctors Become Patients. I interviewed 75 doctors who became patients, uncovering what they learned in being a patient they didn't know before about how to treat other people. And a lot of that was about mental health issues, spiritual issues that came up. Doctors would say, patients would say to them, "Doc, would you pray for me?" They'd say, yeah, whatever, and poo-poo it. And then they became a patient and realized how important spiritual issues are also important. So people might find that of interest as well. And some other books.
And your other books are all available online or bookstores and stuff. So
yep.
Well, thank you for spending this time with us. I know you had a busy day. You had a lot of meetings, you said. And everyone out there, please stay safe. Next week on November 17th, I'm going to interview 3 journalists from Europe. So we'll do it in the afternoon because it's 6-hour time difference. But one is from Sweden, one is from Germany, and the other is from France. They're all award-winning journalists, and they're all covering COVID. And we're going to talk about what it's like to cover COVID and also experience it. So thank you, and thank you to Joe Bonner for being in the background and producing this for us. And this will be on our YouTube channel tomorrow.
And David, thank you. And Joe, thank you. And thank you all for the questions. And thank you all for joining us. And stay safe, everyone.
You too. Take care.